So you're gonna check before you go in. We already know Mrs. Tinkle. We've been taking care of her for the last 3 days. Her nutrition status has improved. So the doctor ordered for removal because she started eating. We gave her Megace and her appetite got better. She's eating. So you're gonna go in, you're gonna hand sanitize. Hi, Miss Tinkle. I remember I've been taking care of you for the last few days. The doctor has ordered to remove that tube out of your nose. Many of them will be very grateful. So I'm gonna put this across your chest. When we remove this, it's just gonna glide it right out, okay? Put in some gloves. Go ahead and gently remove. And remember, you do have on gloves. And with this one, you definitely need to have something on your chest. Just slide. Goes right out. Cover this here. Throw this in the trash. That's it. Giving meds through an NG is 1 at a time. You guys remember that, right? So you're just going to always check placement. Always check placement. Get this little device, put it here so you don't lose it. So you don't go to your patient's room and it just looks like that without nothing on it. That's the holder for it. So once you've checked, they say usually about 20 to 30 cc's you want to flush. Add your medication, flush again, 1 at a time. Okay? We talked about that last week. I think most of you are good with that.
Once we get meds, is it, well, when we're gonna give meds, do we aspirate again for gastric secretions,
Yes.
or do we just
For check
auscultate?
placement. Yeah, I like to, because even if you auscultate and you get, let's say you get about 10 cc's, you can always, it's like a double check. You can put maybe 10 more of air, and then you got gastric content and you got air, so that's
Okay.
2 verifiers.
Okay.
That's my practice. Any others? If you're gonna do feedings, then once again, right before you start your feedings, most hospital policies, just you're checking residual at least every 4 hours, making sure that there's not too much. Some doctors will allow up to 200 of residual. It just depends. They will be specific in their doctor's order how much they want. And if your patient has really high residuals past the rate that the doctor has given, then you would want to hold and notify the doctor. Many times they just need a little bit of Reglan to help digest this. Sometimes you want to listen to their bowel sounds to see if they're having any bowel sounds, maybe it's slowed. So a little bit of Reglan will help them with that.